All right, hello and welcome to Southern College Optometry's October webinar on the SCO campus and clinical facilities. Thank you so much for joining us. I hope you all are staying safe and healthy. My name is Avery Cunningham. I am a Student Services and Admissions Officer here at SCO. I'm one of the admissions team members who will be answering your admissions questions and participating in the admissions process. Before we get started, I ask that we all use proper Zoom etiquette by keeping microphones muted unless speaking, limiting background noise, and respecting all of this webinar's attendees and facilitators. We will have time for questions towards the end of the webinar, but in the meantime, if you do have any questions or concerns that need immediate attention, please use the chat feature at the bottom of your screen to communicate with us. Today, we'll be discussing the SCO campus and clinical facilities. A member of our student ambassador team will be walking you through each aspect of the SCO campus, from the tower to the eye center to the activity center and our external clinics. Savannah Krall will be the student who will be facilitating, and we'll give Savannah a quick chance to introduce herself, but I do want to remind everyone that this webinar is being recorded and will be free and available to view starting next week on our website. Savannah, if you'd like to take a moment to introduce yourself.
Hello, everyone. My name is Savannah. I'm a second year here at SCO from Michigan, and I am super excited to give you guys an overview of all of the facilities we have here at SCO.
Wonderful, thank you. So then we'll go ahead and get started.
So just a little overview of the tower. SCO was opened in 1970. We did do renovations in 2013 at the request of students. We added things like a new addition to the building, where we have new classrooms, which you'll see pictures of here, as well as the atrium, where we have a ton of natural lighting. So we're really excited to show you what we have here in the tower, which is where we have most of our classes, as well as faculty, as well as our theory lab practice, as well as faculty offices and our bookstore, things of that nature. So we'll go ahead and show you some locations here in the tower. So here is the atrium. So the atrium, you'll see, again, like I said, that's part of the addition that was added in 2013. So it's really new, really nice. You'll see there's a ton of natural lighting. Again, something that the students requested, to have some of that nice natural lighting to take a break in between classes and study in this area. As you'll see from this picture, we hold a lot of events here in the atrium. It's a nice open space to do that. We hold things like the student org fair. We have a ton of clubs here at SCO from any interest you could think of, such as ocular disease, low vision, SPOSH, Fellowship of Christian Optometry, neuro, private practice, student government, and student ambassadors, and many, many more. So again, just a really nice place to go study and get some natural lighting. This is right next to, or right in between rather, some of our lecture halls here. So it's really nice to get out there, eat some lunch or some snacks in between classes, socialize or study. So moving on here to the theory labs. So first and second year, we have theory, and theory is we have both a didactic portion as well as a lab portion. And theory is where we learn really the meat and bones of how to become an optometrist. So in first year, we're learning the refractive sequence, we're learning chair skills, how to work with prisms, things of that nature, case history. So really the first half of the exam is what we're learning first year. You really get pretty much by the end of first year, you know most of what you need to know to prescribe a pair of glasses. And then second year, we move on to more of the health aspect of the exam. So for example, as a second year right now, I'm learning things such as non-contact endoscopy, gonio, BIO, so a lot of really exciting skills to really get into looking at the health of the patient's eye. So in theory lab, you'll see at the bottom left there's a picture of the lanes. The lanes are set up much like the lanes are in the eye center. So that gets us ready to really jump in and see patients once we start doing that third year. So each of the lanes, like I said, set up much like the eye center, except for the exception that each lane has a little bit different brands of equipment. And so that's so that we can get comfortable working with different brands of equipment. So again, you're ready to jump in at any practice. as well as get a sense for what equipment you like the best. For people who might be starting a private practice, you might want to know what brands and things of that nature that you like so that you're ready to make an informed purchase at that point. So in Theory Lab, we are practicing these skills on each other. Each semester, you're in a different lab group with different people, and then each lab session, you are partnered with a different person so that as you're practicing these skills, you're getting to do that on many, many different patients and many, many different eyes. So some really good experience. And then we do have practicals in Theory Lab. So that's when one of the lab doctors or staff doctors watches you perform a skill in a set amount of time and ranks your performance. So it's a little scary at first. It's for a lot of us, I know it was for me the first time doing something like a practical, but you really get used to it. And then really enjoy, that feedback and learning in that way, really hands-on. And it does mimic what, you do for part 3 of boards when you're performing a whole eye exam in front of the board examiners in Charlotte, North Carolina. And then the Theory Lab is also open outside of lab time so that you're able to practice. Oftentimes there is a TA, which is a 3rd or 4th year, who can come watch you and help you hone in your skills and give you some advice on those skills. So moving on here to our next slide, we have the north-south classrooms. So as I mentioned, there's didactic portions. We obviously have lectures. So the thing that I love about SCO is that because it is an optometry school only, when we go to these lecture halls, every professor or teacher who's coming in to give us a lecture is an optometrist. So it's really great that we can raise our hands and ask questions that are specific, even if it's just a biochem class. You could raise your hand and ask, how does this pertain to the eye? And so I find that really exciting and helpful. And then of course, as you're sitting in lecture, all of your classmates are future optometrists as well. So you'll see it's a very big space, plenty of room to spread out here. You go to the north south classroom, and then you go to your unassigned assigned seat that people love so much, and then you sit there for the duration of whether it's 3 or 4 classes, and then the staff doctors come and rotate out to you. So no scurrying around campus and finding different rooms. We do have so like I said, this north south classroom is also a part of the new edition that was added in 2013. So it's a newer classroom. We have it outfitted with some great technology that's very helpful. For example, each of those seats is outfitted with a charging port that's right there built into the table there, so you can charge your devices, as well as microphones at each station. And the reason that we have these is because it is a rather large lecture hall. We want to make sure that any questions that are being asked are projected for the whole class to hear and benefit from. Recording the questions also ensures that the question is picked up on Panopto. So Panopto is what we have it's a system that allows each lecture to be recorded. So that way, if for some reason you miss lecture, or if you just want to go back and review the lecture as you're studying it at a later date, that's something that is available to you to go back and reference. So that is a great resource that I have found extremely helpful. We also have other resources in terms of our didactic portion here of school. So we have a note taker service. So our note taker service, each semester, people submit anonymous notes if they'd like to be the note taker, and then those are voted on, and then a note taker for each class is selected. And then that note taker makes money based off of the students purchasing the notes. So the notes are very affordable. I tend to purchase all of them for each class just as a resource to have. Price varies on the credit hours. So it can be anywhere from $5 to maybe $10, $15 for a set of notes for the whole semester. So that is one service that we provide. That's a great resource. Another great resource is our tutoring. So tutoring is free to students. However, it is a paid position for anyone doing the tutoring. So 2nd and 3rd years, if they're interested, can sign up to be a tutor, and it is a paid work study position that is available through the school. So you're paid by the school and free to the students. So again, another really great resource that helps out here with our didactic portion of school here. And so first years have classes, lectures in the morning, lab in the afternoon. 2nd years have lab in the morning and lectures in the afternoon. So that is our north-south classrooms. Moving on here, we have the LRC, or Learning Resource Center. So the Learning Resource Center is what many might call like a computer lab. So you're able to go in here and use these computers if need be, as well as print in this location. We do have some great staff at the LRC that are very tech savvy and have helped with, for example, if you're having trouble with the software that we take our exams on, they help with that. Maybe your computer's broken. I've had a friend who had them help out with that as well. So some really helpful faculty who work here at the LRC. And moving on the fourth floor, we have our sort of cafeteria area. This was renovated in 2017. You'll see in the bottom right there, we have those nice little study nooks with some great natural lighting. Again, students requesting more natural lighting and SCO, really being receptive to that. Renovated this area to make it a more conducive study area, as well as a nice place to hang out and eat some lunch. We started partnering with a square meal in 2020. So we previously partnered with a different lunch service, but again, students requested something that had more options. And so now students have been loving a square meal, and it's a great place up here to get some food. You can also always, of course, bring your own lunches. On this floor, we do have a ton of refrigerator and freezer space for that as well. And moving on here to the library. So the library is on the 5th floor. The library is one of our reserved quiet spaces here on campus. So it's a great place to study if you need a quiet place to study. There's also a work study position here. So there's many work study positions throughout SCO. Some of those include, like I said, being a tutor, the library, the activity center, in the communications office, as well as some in the I Center. So a lot of great ways for students to make money here on campus while also balancing their time and being able to study. The library also has a ton of books to check out. So pretty much any of our required books are there for checkout. So some of them don't need to be purchased. You can always go up there and check out or scan, as well as checking out some of our anatomy models. So the library is a great resource for all of those needs. And then moving on here to our next slide, which is the Hayes Center. So the Hayes Center for Practice Excellence is an amazing resource that helps us really learn pretty much business management. So we learn a lot of things through them. They have different programs, such as our class actually last year, they piloted with us a program called Connect, in which anyone who was interested, they partnered us up with private practice owners. And then we did multiple Zoom meetings, and then we had that resource so that we could learn from them, ask them questions. So that was a really great program that we really enjoyed. And so I believe that we're going to continue doing that Connect program. Other things that the Hayes Center does, the Hayes Center will help you do practice interviews, review your resume, really, again, help you get ready for the real world of practicing optometry. They will even, once you've received a job offer, they will review that, make sure you're getting a fair market estimate. So really help you get employed. We do other things such as alumni networking. They do seminars like the Focus on Your Future events that help us learn, again, more about really how to be business savvy and how to be, how to open a business or things like that once we've graduated. So not just how do we take care of our patients, but, what do we do outside of that to run a business and things of that nature. And moving on here to student services. So student services is on the 11th floor. That's where Mrs. Cunningham's office is, as well as Sunny, Mr. Robertson. So the student services here, we really work with them a lot, especially during the admissions process, but they're really there for, I go up and chat with Sunny. She's always a good ear to listen. So there's also the president's office there on that floor. And moving on to the next slide here, we have the Eye Center. So the Eye Center, a little overview. So it opened in 2002, and it is one of the most premier optometry clinics in the country. It's 50,000 square feet, so it's a pretty big clinic. We do have a high volume of patients. We see up to about 50,000 patients per year. And so what that means for our students is that we're having about 2,600 to 2,900 patient encounters by the time we graduate. And so, of course, that depends on where one chooses to do their externship rotations. But that's a really good estimate of the amount of patients that we're seeing. It's set up much like a hospital in the sense that we have many different subspecialty clinics throughout the eye center. So for example, adult primary care, pediatric primary care, advanced ocular disease, surgical services, and many more. We have a teen clinic. And then that also includes an advanced procedure suite where we have lasers performed, and we will go into each of these in more depth. All right, so the eye center lobby, so this is where patients check in when in the eye center. So you start in the eye center. Second year, you start shadowing. Third year is when you start actually seeing patients. And so we do have a 4:1 staff doctor to student ratio. And that's pretty standard, but the great thing is that because we have such a high patient volume, we do not share any of our encounters. So when you're seeing a patient, you really have the reins on that encounter from start to finish. And so that's a great way to, of course, really learn along the way. So here in the lobby, the third years or fourth years come out to grab the patients and then bring them back to the respective suite in which they will be seeing them. So moving on to the next slide, one of our suites we have here is our primary care suite, so adult primary care. So a lot of people think adult primary care and they think, like a private practice, very basic exams, but because where we are here in Memphis, we see a high proportion of ocular disease and things of that nature. So really what I've heard from a lot of third years is that you never know what's going to show up in adult primary care. And so a lot of times you will be the first to find something that might need to be referred to one of our other specialty clinics. So adult primary care, we see ages 19 and up, because we do have, of course, pediatric and teen suites that care for some of our other populations. And so moving on to our next slide here. We have our advanced procedure suite that I mentioned. So here you'll see, you might be able to see in the back there of that bottom left picture, the glass there. So behind there, we have an observation room. So students are able to sit in that observation room while an ophthalmologist is performing these laser procedures. So you'll see that big in the upper left picture, you'll see that big TV. So each of the lasers, such as YAG lasers, argon lasers, are outfitted with a camera at the end of it, so that as the procedure is being performed, they're projected up onto those TVs and we're able to watch. So of course, you may or may not be familiar that optometry is a highly legislated profession. So certain states, optometrists do have the privilege to perform lasers, while in others they do not. Here at SCO, we do train to the fullest of scope, so you are able to be ready to, regardless of what state you go to, you'll be ready to go ahead and, go to those continuing education courses and be certified for lasers. We want to make sure that we are trained to the fullest of scope. So we partner with the eye specialty group, which are ophthalmologists in the area. So we have a great relationship with them. And again, they perform these procedures, and then us as students practice on model eyes. So moving on to our next slide here, we have vision therapy. So if you're not familiar with vision therapy, a lot of people, when they think of vision therapy, think of children. And of course, we do see a lot of children, but really what vision therapy is that we're working to enhance the connection from the brain, or from the eyes to the brain. So really strengthening those neural pathways. And so we do that through a variety of methods, whether that's games. You'll see in the upper left-hand corner, those little blocks on the table. So whether that's through games or technology, as you see in the lower right-hand corner, games, technology, prism, different types of lenses, prism lenses, things of that nature, again, working to enhance the function of the visual pathway. And so we can do that with children, whether that's a child with a strabismus, or we can do, as you'll see in that upper left-hand corner, there's a patient wearing what looks like a jersey. And so we can work with athletes to enhance their hand-eye coordination in their sports performance, or working with people who have had traumatic brain injuries and need to repair those neural connections. So it's a very interactive, very exciting clinic here at our suite here in the Eye Center. You do have a lab in the tower that prepares you for that as well. Moving on to our next slide here. We have the practice suite for board exams. So in the eye center, we have a room that is set up almost exactly like where you'll be taking part 3 of boards in Charlotte, North Carolina. And so the BIO in that room is outfitted with a camera on the end. And also you cannot see it in these pictures, but up in the corners, there are casino-like cameras that record you practicing. They project to another room with a TV where you can either have someone watching or it can be recorded for later for you to watch. So those casino-like cameras really get every detail. So for example, you can see all of the numbers on the phoropter as you're performing procedures. So it's a great way to really get as prepared as possible for boards. And moving on, we have optical. So we do rotations in the optical. We do have one of the largest opticals in the area, and we really make sure that we are catering to all of our patients. So we have tons of great selections of frames for any need that a patient might be looking for. We are working with patients to help fit them, help choose frames that are right for them, help choose lenses, and things that are right for them. We look at and work with their insurance, and then also help with fitting and dispensing those glasses after they're made. We do also have a optical finishing lab. So we as students also get the experience with surfacing and finishing those lenses, which is a great asset because of course it might not be something we're doing every day as an optometrist, but a lot of optometrists who open private practices do train their staff from the ground up. So it's great to be able to know how to do all of those things that you might be teaching your future staff to do. And then of course we have pediatrics. So pediatrics, obviously we're working with a younger population here. In peds, we're seeing anything from infancy up until 12 years of age. So we really want to make sure that we're able to cater to our younger patients, make sure that we know how to give what might be a nonverbal or pre-verbal exam, know how to give an objective exam where maybe the patient's not able to respond to us. We also know that the pediatric population has very unique binocular vision needs. So young children, of course, are increasingly spending more and more time on digital devices, all of things which we need to be able to take into account and know how to care for the different issues that our pediatric patients may experience. And moving on to ocular disease. So ocular disease, of course, is where we're seeing patients with ocular disease. So we do have a low vision clinic as well. Low vision, of course, is when the disease state has progressed to maybe something where we're really just at that point trying to enhance the activities of daily living. Whereas with ocular disease here, you know, we're trying to treat that disease, regress the progression of the disease for our patients. So again, here in Memphis, we do see a rather high population of ocular disease here, rather high incidence of ocular disease in our patients here. So this is a great suite here to really get that experience. And moving on to our next slide. We have our external clinics. So we have other clinics as well that are not just at the eye center. So for example, we have FOCALPOINTE, we have University Eye Care, we have MOBILEYES. So these are great ways for us to see different sets of population than we normally see in the eye center. And so we will go ahead and discuss each of those. So we have, as I mentioned, FOCALPOINTE. So FOCALPOINTE, you might have seen in that last slide, there was an image of Crosstown Concourse. Crosstown Concourse is a large building. It's kind of like an indoor town square we have in Memphis. And so we have one of our remote locations here. So at FOCALPOINTE, it really simulates more of a, and you'll see from the pictures, it really reflects that, more of a boutique private practice style. So as I said, the eye center is very much set up like an institutional type care center. So much like a hospital, whereas FOCALPOINTE again is more of that private practice feel. So, you know, we want to make sure that we're exposed to many different modalities of practice, and this is a great way to do that. And moving on to our next slide here, we have the University Eye Care. So University Eye Care is on the University of Memphis's campus. So we see mostly a lot of students and faculty there. It is, however, open to the public. So this location was created in response to wanting to see more of that young, healthy population. So again, we see in the eye center, we see a lot of incidents of ocular disease and things like that. So we wanted to make sure that we can also care for a younger population who might not have as many things going on. It might be more of a standard eye exam, but patients who are maybe looking for colored contacts. So a lot of experience again with some more private practice things that you might see there. And moving on to our last, one of our last remote clinics here, we have MOBILEYES. So MOBILEYES, we have outfitted lanes and an optical in the MOBILEYES. And so the reason that we have MOBILEYES is because we know that there are boundaries to care. We know that there are people who, for one reason or another, don't have the transportation or means to come get an eye exam from one of our clinics like FOCALPOINTE or the eye center. We want to make sure that we are caring for our community here at SCO. So it's very important that we're able to use MOBILEYES to get out there. We also do learn how to give eye exams. For example, we go to nursing homes and learn how to give eye exams to a patient who is lying in bed. And so again, caring for all different people who for some reason might not be able to get to us and making sure that we're giving that care to our community. All right, so we are going to go ahead and open it up to questions here. Of course, any questions about any of the facilities that I discussed. We do have more things that might not have been mentioned that you're interested in learning more about, or even if it's just anything about life as a student here at SCO or life in Memphis, I'd be happy to answer any of that.
All right, and again, everyone, please feel free to use the chat feature at the bottom of your screen. There's also something called a Q&A feature, which functions essentially the same way as the chat feature. Feel free to use either of those methods to communicate with Savannah, and we'll be happy to answer your questions. All right, we have one question from Abigail. Were the cafeteria and library both in the tower? And is the eye center in the tower as well?
So yes, the cafeteria and library both in the tower. So really everything up into the point of discussing the eye center, that was all in the tower. So we have the tower, and then off of that we have the building that was added in 2013 that has the atrium and the north-south classrooms, as well as our theory labs. And then attached to that as well is the eye center. So while not everything's in the tower, where we have 11 floors, the tower is mainly where we have lockers, as well as some of our other labs that we didn't mention, like ophthalmic lab. We have optics lab, vision therapy lab, contact lens lab. So really a lot of our labs there in the tower, labs, lockers, faculty offices, as well as some study areas. While again, that addition to the tower, which is it's connected, but offset there. So that's where we have the north-south classroom, the atrium, the theory labs, and then again, connected to that, we have the eye center. So while it's not all in the tower, it is all in one convenient location. We have the one campus here where we spend most of our time. So I hope that answered your question.
All right, we have another question from Colton. Where do most students live around Memphis? They live close to campus.
So most students live on what we call Mud Island. So Mud Island is about a 10-minute drive from here. It's right on the Mississippi. It's a really cute location with a ton of apartments right on the Mississippi. We have a lot of young professionals who live there. So whether they go to the Southern College or they go to University of Memphis, it's a great little community there on Mud Island. Personally, I live out in Bartlett, which is a suburb of Memphis. There are fewer students who live out in the suburbs. My boyfriend and I chose to purchase a house out there. So it's a little bit further of a drive, but we just wanted something out in the suburbs where we could walk our 4 dogs. So I see we have.
All right. Oh, I'm sorry. Yes, there's a follow-up from Abigail asking, is the tower mostly used by only optometry students?
So I believe what you're asking, so there are schools who, for example, schools who have a larger university and then a optometry program as a subset. But SCO is an optometry school only. So we have, so everyone here is either an optometrist or an optometry student. So it creates a really great community where we're all working towards the same goal here. I hope that answered what you were asking. Please let me know if it didn't. And then externships, we have, actually, I believe we have either the most or one of the most externship sites. We do have 122 externs. We do have a map here on campus that shows little pins of where they all are, but we really have locations pretty much all throughout the United States, definitely heavily concentrated in the Mid-South, but we do have some out west as well as up north. And so when you do externships here at SCO, you do 3 rotations fourth year. You do one at the eye center, one at a private practice, and one at what we call an institution, which would be something like a VA or an OD/MD practice, something, you know, very medical-based setting.
All right, I'm not currently seeing more questions or comments in the Q&A or the chat. We'll give it about a minute or two more for additional questions to come in. But I guess while we have you, Savannah, do you want to talk? Oh, here we go. Let's see, Abigail has a follow-up. Will we pick only a few rotations to do at the eye center, or do we get to do them all?
So as far as picking some, I believe what you're referring to is in the different suites. So you do get experience in all of the different suites. So for example, third year, you're primarily in adult primary care as you're learning and practicing more how to give just what might be more of a general eye exam. And then fourth year during the rotation here, you're in more of those specialty clinics such as vision therapy, teens, peds, low vision, ocular disease. So you do, of course, get experience in all of those different suites.
Thank you. And then we have another question from Colton. What are the interactions like with students and professors? Do you have the option for face-to-face, or is it more email type communication?
All right, and thank you, Abigail. I'm glad I was able to answer your question. And then Colton, so the faculty do have offices here on campus, so they make themselves pretty available. All of them are very, very happy to help. And like I said, they're all optometrists, so they all know what it was like. They're all very excited to help us learn and become future clinicians. So again, they all have a pretty open door policy. All of the first year professors have offices right next to where your lockers are. So again, makes it really accessible to speak with them. Of course, you could always send emails, making sure they're in their office or asking to meet in their office. So we really do a combination of both, whether it's easier to send them an email or go straight to their office and have that face-to-face encounter. And then Kathy, so is there other study areas in the tower? Do we have other,
I think the question is access to other libraries, maybe.
Okay. So we have a ton of different study areas. So throughout the atrium, as well as near the theory labs, and then in the tower, we have a ton of reservable study rooms, as well as just open study rooms. And so each of those are outfitted with a whiteboard, as well as a TV and an HDMI cord, in which you can hook up your computer. I know a lot of people do like Quizlets with classmates on those up on the TV as they project it, or study on the whiteboards, things like that. So we have a ton of reservable study rooms, as well as, again, open study areas as well.
All right, then another question from Colton. I noticed your board pass rates are extremely high every year. What is it that sets SU apart in this category?
Colton, that is a great question. So as a second year, boards are third years, so I haven't really started thinking a lot about boards yet. But from my personal experience, what I think sets SCO apart and that allows us to have those higher board passing rates is a lot of those resources that we have. So we have, like I said, the free tutoring. We have, the Panopto with the recordings. And then really, I think another thing that's hard to quantify is just the professors. We are not, like I said, we are an optometry school only. So all of our professors are optometrists, and they all really, really are so invested in seeing us succeed and become their future colleagues. I think we have some great professors here. I think that's something that helps sets us apart. One thing that people always say about Dr. Jackson, I've heard a lot of third years say that he taught optics so well that some of them are not even having to go back and look much at it. They remember all of it so well as they're going back and studying for boards. And then, you know, that sense of community we have from our classmates here, as we are all optometrists working together towards that common goal. And then, you know, our theory labs are great, really training us to be great clinicians. Of course, the eye center is great experience as well. We see a lot of different things. And I think that, you know, our patient population here and our great facilities here really prepare us to do well on boards.
All right, and questions on Sam. How personalized are the classes and rotations from years 1 to 3? Are class sizes still large, or is there more one-on-one time with professors?
That's a great question. So the first and second year, all of our lectures are rather large. So we have all of our classmates in there. So, you know, 130 to 136 students. You would think that that is a lot. But really, I found that I still, you know, my professors still know who I am. We still have a lot of interactions. For example, we have theory labs, which are split down into lab groups of about 30. So when you're in your lab groups, that's when you really get the time to get one-on-one time with your professors and learn more from your professors on that one-on-one basis. All of my professors have known my name, and they definitely make a point to do so. So we definitely form good connections with our staff doctors. Also, third year, we do have some more classes that are broken down into smaller groups as well.
Alrighty, so once again, I'm not seeing any new questions coming up in the Q&A or the chat. Thank you all so much for asking questions. Oh, here's another one from Colton. Well done. What are the scholarship opportunities at SCO?
So Avery, would this be something that you'd be comfortable answering?
Sure, of course. So there are a couple of options for students when it comes to financial aid. One of the first things students think about is regional tuition. The base tuition amount that is clear to every student, really the main tuition price is what we call non-regional tuition. Now, if you are a student who is a permanent resident of a handful of states, those states include, like say, Arkansas, Mississippi, Georgia, Tennessee, then you may be eligible for something called a regional contract seat. And this is where the state of your origin will pay for a portion of your tuition. For some states, you're required to return to that state after you graduate to serve essentially for a period of time, but that is not required for all states. The caveats with the regional contract seats is that one, there are very few of them per state. Not every Georgia applicant who is accepted, for example, is going to have a Georgia contract seat, no matter how strong their application is, just because there aren't that many of them. And then two, you do have to be considered a permanent resident of that state in order to be eligible for the regional contract seats. Outside of that, there are dozens of scholarships available to students starting with their entering class year. A majority of students actually do receive a scholarship of some type, when coming into SCO, and the amounts can range. We have our most competitive scholarships, $25,000 a year, and then one full ride scholarship for a minority applicant, and then down to as low as $1,000 a year, even though every dollar counts, of course. And where some students might notice a difference with SCO is that the admissions committee decides if a student should be awarded a scholarship and for how much. That's a little bit different from some situations where you can kind of pick and choose what scholarships you want to apply for. You're not able to do that here at SCO, but the admissions committee is really great at taking a holistic approach to a student's application and viewing their presentation as a whole, everything from their OAT scores and transcripts, of course, to their leadership, to their experience, to their letters of recommendation, to their application interview, and all of that goes into consideration when making scholarship decisions. The best thing you can do for yourself if you're not eligible for a regional contract seat, but you know you could be eligible for a good scholarship, is to apply early. The scholarships are first come, first served. So even though occasionally we do have some of our stronger scholarships become available later in the cycle if a student chooses to withdraw. The earlier you apply, the earlier you'll have access to some of those higher ranking scholarships before they're all awarded. So that will always be in your best interest when you're looking at the financial cost of SCO. And then let's see, we can maybe both address this one. So then we'll see what your perspective is. From Abigail, do we need to have taken prerequisites before interviewing, or is it all right as long as they are completed before matriculation into optometry school? Okay, I'll address this one. So with the prerequisite courses, it is okay if you don't have them all completed by the time you interview, but you do have to have them all completed by the time you mean to matriculate into the program. So you may be offered what is called a tentative acceptance, where in lieu of your other prerequisites being completed, you will need to have, like, say, an updated transcript by the end of your cycle before the August of the year you'll be entering the program, just so we can confirm that all the prerequisites have been completed. So usually we do have some students that maybe have one or two prerequisites that they have to finish or are in the process of completing before they, or while they're applying, I should say. So it's perfectly reasonable for you to receive an acceptance of all of your prerequisites. And then from Shannon asking, are there any legacy scholarships? There may be some smaller scholarships that are specifically come from our donors and our alums who may have certain aspects that they look for, like, say, a student who is the child of an SCO graduate. We have some scholarships that are specifically noted for students from certain states outside of the regional contract seats. We have scholarships noted for students who have military experience or who come from military families. So for those smaller scholarships, there are some available, but there are no large, like $25,000, $20,000, $18,000 a year legacy scholarships. And then another question from Abigail. When it comes to applying early for scholarships, what exactly qualifies as early? Can you give it an approximate month that my application should be submitted before? And then, so then I'll ask for your personal experience. Around when did you apply for optometry school here at SCO?
So for me, I actually took a 2-year gap year. So I applied really early. I believe my application, oh golly. I'll be honest, Avery, I think it was sent in August and I was interviewing in October. Yeah,
Okay.
that's what I recall.
Yeah, I mean, that makes a lot of sense if you're applying around that stage. And, you know, of course, like we say, for students, it's the best possible thing you can do is have your application in by the opening bell, more or less. That's June 30th, July 1st of any given year. But Savannah said she submitted hers in August, and that's also a great time to have your application submitted. That's still within the first few months of the application cycle. My personal recommendation to students has been to have your application in before the holiday seasons, before the Thanksgiving, Christmas season. That'll put you in kind of the first 2 waves of the application cycle. After the holidays, you're reaching into the last wave of the application cycle. But the earlier the better. August is a great month. And as Savannah said, it's still considered fairly early in the cycle by then. Alrighty, thank you all so much for your questions. Any other questions? We'll be happy to answer. Well, you're very welcome, Colby. And you as well, Abigail.
Thank you guys so much for allowing me to be a part of this. My email, of course, if you want to take that down at the bottom of the slide there, please email me anytime you guys have any questions. Again, whether it's about our facilities or even just life as a student or life here in Memphis, I am so happy to speak with you guys further and talk about any other questions you have that might come up.
Yes, thank you so much, Savannah. And as she said, everybody here at SCO is always open to communication. So if at any point you have any additional questions, please reach out. Whenever you see fit, we'd love to be of assistance. If you haven't done so already, I invite you to request more information by signing up for our inquiry form. You can see the link on the screen here, where you will receive a personal advisor and a personal brochure with information relevant to your goals and experiences. Thank you so much, Savannah, for sharing of your time and experiences, and a special thank you to all of our attendees. We hope to see you all at the next webinar next month on life after optometry school. But in the meantime, have a great rest of your week and take care.